Greetings, students. I just want to take this opportunity to go over Foley catheter insertion with you, Foley catheterization of the female patient. So I've already identified the patient, I've explained the procedure, I've washed my hand, donned gloves, and I am providing privacy for the patient, okay? So the patient understands the procedure. I placed my patient in dorsal recumbent position. This is the position for Foley catheter insertion. If the patient can tolerate it, I've already provided perineal care for the patient prior to the procedure. I've cleansed the perineal area. I've assessed it for any skin breakdown, discharge, lesions, irritation, odor. I've already assessed that. So now I am going to get ready with the procedure. Okay, so I have my kit. I can actually sit my kit here. Okay, so let me take off these gloves, wash my hands, and apply sanitizer. So I'm gonna open my kit, right here, and then away from the patient. I also want to explain to the patient the procedure that I'm performing. When the patient understands the procedure, they sometimes become more cooperative. Okay, we don't want them to mess up my sterile field. So I'm going to remove my gloves first, and then I can apply the drape here, but I'm not going to actually use the drape because it usually interferes with my seeing what's going on with the patient. So I'm not going to use the drape. So I am going to now apply my sterile gloves. Okay, I'm going to apply them right here. Actually, I can just bring my table over, and I am going to apply my sterile gloves here. So I'm going to use my left hand to glove my dominant hand. Okay. Use my right one here. Sorry, but these gloves are old and they are sticking together. So I'm going to glove my right hand. Then I am going to now glove my dominant hand. Oh my gosh. So this is, excuse me, this is very sticky. So I'm gonna lift up and apply my left hand, okay? So now my hands are sterile. And so now I am going to prepare my supplies. Okay, I can actually scoot them up a little closer to the patient. Everything is prepared here. Okay, I have my balloon, sorry, my tubing, all right, this is for my specimen. All right, here's my syringe, and here's my my jelly, my KY jelly. So I'm going to open, all right, prepare my items here. And if I need to obtain a specimen, I want to have that already ready to obtain a specimen. Usually when you're inserting catheters for the first time, you want to obtain a specimen to have a baseline. Maybe the patient already has an existing UTI. And I'm going to open my lubricant, and I'm going to squeeze it here in the tray. All right. Now, evidence-based practice says that you don't have to assess the patency of the balloon. Okay, you don't have to, but usually I do. So I'm going to attach here and assess. So I'm going to remove the plastic protective coating here, making sure that my catheter doesn't touch anything else, and I am going to assess the balloon. You don't have to do it. Evidence-based practice says you do not have to do it. I'm going to leave my syringe attached here. Okay. And now I'm going to apply the betadine now. Okay. So I'm going to first, I want to perform my hand placement. So I'm going to open the labia nice and wide. Now remember, you only have one shot at securing the labia. If you lose your grip on the labia or you have to reposition your fingers, you need to start over, okay, and apply sterile gloves. My hands shouldn't actually be touching this cloth here. It should be out of the way. All right, so I'm gonna go ahead and cleanse here. Left. All right, discard. Grab another. Okay, right. And then right down the center. Wow. Okay. And right down the center. Okay. Left, right, center. So now I'm gonna grab my catheter tip and I'm gonna lubricate it 2 to 4 inches in the lubricant. I am going to tell the patient to bear down, okay, which opens the urethral meatus. Okay, so now I am going to insert the catheter. Okay, I'm inserting the catheter. Once I see urine return, I'm going to insert it 1 inch further. Okay, so now that I see urine return, I inserted 1 inch further. Now I'm going to grab it here, secure it, and inflate the balloon. Okay, so I'm going to inflate the balloon. I'm not going to inflate it all the way, but I'll inflate the balloon, detach from here. Okay, and I'm going to assess it here. Okay, the catheter is stable. So now I am going to remove the bag from here. I got a little betadine on the bag. Okay, and so now I am going to coil the tubing. All right, I'm gonna coil it, make sure the catheter is secure to the patient. And we always want to hang the bag below the level of the bladder. We always secure it to the immovable part of the bed. All right, so once we've anchored this, the catheter is secure. We document how the patient tolerated the procedure. We document the size of the catheter. We document if we obtained any urine specimen. We document the color and the clarity of the urine if we obtained a urine specimen. And we put the patient in a comfortable position. We lower the bed and the call light should be within reach. Okay, that is it.